It's going to happen eventually. Your horse is going to have a cut or a scrape or a gash or a puncture wound. And it's not the end of the world, especially if you know what to do. The first thing you're going to do is not panic. Even if you see a lot of blood coming out, as long as it's not spurting, like they've cut an artery, that's just his way or her way of healing himself or herself. Right? That blood is going to be flushing out some of the bacteria that's trying to get trapped inside the wound. Right? But we're going to help that out a little bit. Okay? So you're going to put your horse up in a nice safe place, maybe have somebody watch him, and gather your materials. Right? The first thing you're going to want is your phone with your vet's number in it. Okay? You're also going to want to get some gauze sponges with some betadine solution to scrub out and around that wound to get an idea of what's going on. You're likely going to need a thermometer to take his temperature. You might want a stethoscope, especially if your vet's going to ask about other vitals of your horse, which we'll cover in a different segment. I usually like to have a syringe to make sure I'm going to flush that wound out, especially if it's a puncture wound, and some sort of wound dressing. Okay? And I've included, for our fly season, some fly repellent ointment. Okay. So the very first thing you're going to do is assess the situation. If your horse is not spurting blood, it's not a drop everything and call the vet right that moment, you're going to want to get things cleaned up a little bit. So you're going to take your betadine solution, make it a dark tea color, use some gauze, and gently scrub around the area, cleaning it up so you can see what's going on. Sometimes that dirt that they roll around in the pasture can hide a deeper wound or something a little more serious. So that's going to be your first step. Okay? If you do have a puncture wound, you're going to want to grab your records and see when the last time your horse had a tetanus shot or a tetanus booster. Your vet's going to need that information when assessing what's the next step in the puncture wound process. So after you've got it cleaned up, take a couple pictures, call your vet, and they hopefully will either get back to you really quickly or be on the line and ask you to send some pictures. You're going to want to take nice clear pictures, probably from a couple different angles so they can see what's going on. If it's a pretty superficial cut, you may not need to call your vet. In that case, you're just going to take some betadine, scrub the solution, flush it out really well with betadine water, and keep an eye on it over the next couple of days. If you do decide to use an ointment or a cream on top of the wound, you're probably going to need to wash that 2 or 3 times a day. While that might keep some dirt out for a little bit, that dirt is then that they do roll around in is going to get trapped onto the flesh that's trying to heal. So be judicious when you're looking at what type of ointment to use, and it might be best to ask your vet what they prefer. Okay? If you do have something a little more serious, like a puncture wound, you're going to need the rest of the materials that we talked about. Most likely your vet is going to have you flush the wound out, unless it's something really deep that needs your vet to flush out with a hose or a different instrument. Okay, the example that I'm going to show you is one that I was able to flush out just using a 6mm syringe without the needle attached. Okay. The reason I have the stethoscope out is I mentioned that the vet might want some of your horse's vitals, especially if you have a puncture wound or if you have a horse that has a fever associated with that. Sometimes a horse can hurt so much that they get a tummy ache. All right, so we can have an injury-induced colic. You know, anything that stresses a horse out can bring a colic situation about. So you want to make sure that you're practicing taking vitals so that you can keep track of that. So you can see on Jack's shoulder where I've been working before with him. This area that's kind of discolored, orangey red, is not blood. It is a betadine solution. So it's sort of like iodine, where it's going to clean off his skin and clean off around the wound. And then later we're going to squirt this inside the wound. Okay. The reason I'm going to clean off the surface is that it will often have dirt and debris on the outside, especially since he lives out in the pasture. And I need to make sure that gets cleaned off. I need a nice clean surface for me to examine the wound so I can see it a little bit better to see if it's healing, what the tissue around the wound is looking like. Good boy. And also, he lives outside, it's getting a little warmer, so the flies are starting to come out, and flies really, really like wound tissue. And so we want to make sure to sanitize anything that those flies might have been touching. And so all I'm using is a cotton gauze pad and pouring the betadine right onto it, and then gently, very gently wiping away at the wound. Okay. This shoulder is a little bit sore. You can see that he's at times watching me carefully as I get closer to the wound and as I push a little harder. The very first day I did this with him, he was very resistant to any kind of palpitation or cleaning because it was very sore. But today you can see he's feeling a lot better, everything is healing, and the infection is being cleaned from, or closed from the inside out as we're cleaning it from the outside in. Good boy, Jack. All right. So now that everything's clean from the outside, we're gonna take a look, I'm gonna give you an up close look at that puncture wound. The wound that you saw is circular-ish and extends into his shoulder. We need to get the medicine in there as deep as possible, but before we put the medicine in, we need to make sure that it's cleaned out of any dirt and debris that's made its way inside the wound track. Otherwise, all the medicine's going to be doing is treating the dirt. So I have a cup of water. It's filled about a third of the way full of lukewarm water, and I'm going to use the water to dilute the betadine a little bit, and I want it to be the color of dark tea. Here's the color of my very dark tea betadine solution. And I'm going to go ahead and see if I can do this one-handed here. There we go. Suck some of that solution right in. So as you can see, as it comes out, it's a lot lighter looking than inside. Right? And that's just because we have less of the material in the tube than we have in the cup. And it is a nice kind of medium dark tea color. So I'm going to take the tip and very gently insert it into the wound as far as it will go, and then use the plunger and plunge it right into his wound track. So when I first started doing this with Jack, he was very, very upset, as I don't blame him. I would be too if someone was trying to poke this into my open wound that was sore and I didn't understand what was going on. And so he had to be kind of backed up against a wall so he couldn't back up too much. And I had to take this at a much, much slower pace so that he had a chance to kind of process that I wasn't gonna do any more than he could handle at one time. So I'm standing off to the side so that I'm not in the front or back kick zone, but I'm not in a spot where he can easily turn around and nip at me, the thing that might be hurting him. Our horses aren't going to do anything intentionally, but remember, I can't explain to them that I'm trying to help them and make them better. All they can do is react to what I'm doing and my body language. And Jack is super, super good. He's been very stoic throughout this whole thing, and he's been a very good boy. So you can see why you might not want to use a smaller syringe and why it might be easier, as long as the tip isn't too much wider, for the wound track, to use a bigger syringe so you don't have to continually fill this up, push it in, fill it up, push it in. Good boy, Jack. And I'm going to empty my entire cup. Good boy. One more here, buddy. I know. Good boy, Jack. Good boy. And all of this discoloration that you see around him is not blood. There's no new blood coming out. It's not pus, it's not mucus, it's just the color of betadine. So after we flush his wound out with the betadine water solution, we need to put some medicine in it. If you have a scrape or a cut that's fairly superficial or just on the surface, you can go with something a little less liquidy. But I need this medicine to get into his wound track, and something like a Neosporin or a triple antibiotic, I'm not going to be able to get in there. So I'm going to use a different syringe than from the betadine, and I'm going to use the same technique. I want to very gently place that right on the surface, and wait till he settles, which is not very long for him today. And I'm just going to start injecting that into the wound track. Again, there is no needle on my syringe. It is just the plastic tip. There we go. Good boy, Jack. All right. So we have flushed out the wound. This is going to be the last day that I use the betadine water solution to flush out the wound. This has been day 3 of this for him, poor guy. And once the initial bacteria and infection is under control a little bit, you want to switch to just water. The betadine will actually start causing the tissue to not heal as well, and it'll take longer for the wound track to heal. So after your first couple days, your infection's under control, you're going to want to switch to just water to flush out the wound and flush it out really, really well before putting your medicine in. It is fly season, sort of. We're having a warm spring, and the flies have come out a little early this year. So I am going to take this, it's SWAT, you can get it clear, you can get it pink, and it's a fly repellent ointment. Now I'm not going to put it directly on the wound, but what I am going to do is smear it all around the outside. There you go. That's it, I know, buddy. His shoulder's still a little sensitive to touch, so I'm going to go nice and gently. Take what I have, smear it around the outside, trying to keep the flies from going into the wound and irritating that wound tissue that's healing. The last thing we're going to do for Jack is his favorite. He's going to get some antibiotics and some food. Cody's over here hoping that I'm mixing him some dinner, and Cheshire's over here supervising that I do it right. Okay? And what's the right way to do it? First thing is to read the directions. Okay? Jack's going to get oral antibiotics, and we're using Uniprim, also called Tucaprim. Okay? And Jack weighs about 1,150 pounds, which is a great weight for these directions, since the directions tell us that 1 scoop is enough for half of his weight, and 2 scoops is enough for, well, 50 pounds less than what he weighs. So that's a really, really close match. It's just a nice powder, so I'm going to get 2 level scoops. I'm going to sprinkle it over some of his feed, and then I'm going to wet it down, make a little bit of a paste in it so that he can't get out of eating all of it. So here's my nice level scoop. There's 1 level scoop. I'm going to recheck the directions. 2 level loose filled scoops contain enough to treat 1,100 pounds. Perfect. So there was 1 scoop. There's a second. Cheshire's going to help me out here. Okay, my 2nd level scoop. Put that in. I want to make sure Cheshire doesn't eat it because wet down the rest of it and make a nice mushy mash for him. Before I turn Jack out with his friends, I do want to check his temperature. When he came in on Sunday with his puncture wound, the first thing I noticed was not a bunch of blood rushing down his leg. In fact, there was no blood at all. What I noticed is a reluctance for him to go to his hay pile, which is very unusual for Jack. So then came up to him, put a halter on, started investigating what was going on. He had good gut noises, he didn't look really distressed, and that was when I noticed when I was running my hands over him on that puncture wound on the shoulder. So I brought him into the stall, cleaned it out, and took his temperature. His temperature was 103.2. That's pretty high enough to be concerning, which means called the vet. The vet suggested that we flush the wound with betadine water, give him a Banamine, so a little bit of a pain reliever and a fever reducer, and give him some antibiotics. So of course this is on a Sunday, everything's closed, but I did have Tucaprim, which is the oral antibiotic that he's eating now, on hand. Luckily, by the next morning, he was about 95% improved. His fever had gone down. He had no fever, I should say. He was walking almost normal, and while the wound still looks kind of pussy, there was some improvement in the heat radiating around it, as well as his ability to walk on that leg. So luckily, he didn't need any antibiotic shots, and we were able to continue with the oral antibiotics, flushing, medicating, and checking temperature. So his temperature is normal, which is great news. Jack is on the road to recovery.